Welcome to the Get Fit Guys, quick and dirty tips to slim down and shape up. My name is Ben Greenfield, and I'm the Get Fit Guy. Listener Natasha recently wrote in and said, what would you recommend as a minimum exercise routine for someone who isn't concerned about achieving prime fitness, but is more worried about just staying healthy, being able to sprint after a bus, reducing the risks of disease and injury, keeping your immune system and mood in check, etc.? I generally stay active, but I'm wondering what else I should be doing. Bonus points if the recommended plan doesn't involve a gym membership or expensive equipment. Well, this is a great question, Natasha, and while I hope you don't have to be sprinting after a bus too much, I want to give you an idea today of the concept of a minimal effective exercise dose and how little you can actually get away with when it comes to staying healthy. So in this episode, you're going to learn the minimum amount of exercise necessary to keep you at a low risk for things like cardiovascular disease and diabetes or osteoporosis, but that will also allow you to climb a flight of stairs without your heart pounding out your chest or catch that bus. So let's start with the minimum amount of exercise necessary to stay fit. Organizations like the American Council on Exercise recommend at least 60 minutes of moderate activity most days of the week for folks trying to lose weight. But one relatively recent study, which I'll link to in the show notes over at getfitguy.quickanddirtytips.com, actually compared 3 groups of individuals over a 13-week period. The groups consisted of people who exercised 30 minutes a day, people who exercised 60 minutes a day, and people who didn't exercise at all. The people who were exercising were allowed to choose their activities, such as running, cycling, etc., but they had to work pretty hard, about 70% of their maximum capacity, for at least 3 of the exercise sessions in their allotted exercise time, and the rest of the time they could exercise just as hard or as easy as they chose. So, what were the results? Well, compared to the sedentary control group, both the 30-minute and the 60-minute group lost 4% body weight and 14% body fat, and 3% body weight and 13% body fat, respectively. In other words, the 30-minute group actually lost slightly more weight and more body fat. In addition, the metabolism actually increased slightly more in the 60-minute group than in the 30-minute group, but the maximum oxygen capacity, a measurement of fitness of the 30-minute group, slightly exceeded that of the 60-minute group. Interestingly, the people who exercised for 30 minutes tended to have a greater calorie deficit per day than the people who worked out for the 60 minutes, indicating that they had less of a propensity to calorically compensate for their exercise sessions, meaning eat a bunch of food because of the greater amount of exercise. So ultimately, the group that exercised twice as much didn't see anywhere near twice the benefit. So what about the minimum amount of exercise necessary to stay healthy? We know that you can stay fit with as little as 30 minutes per day of exercise, but when it comes to staying healthy, another study tracked over 400,000 adults for 8 years, surveying them about physical activity levels and their health. Participants indicated what types of exercise they did and how many minutes per week they did each exercise. And then the researchers calculated a special number called a hazard ratio, or HR, over the 8-year period of each person's participation in the study. Now, a hazard ratio of 1 is assigned to a completely inactive group, one that would report less than an hour a week of any type of exercise. And any hazard ratio that's lower than 1 means you have an increased chance of avoiding death or living longer, whichever way you want to look at it. Surprisingly, the researchers found that the low-volume, moderate exercisers who exercised just 75 minutes per week, and that's about 15 minutes a day if you do the math, had significantly better hazard ratios than inactive people. And this result held up even after controlling for a number of other factors like age, sex, smoking, drinking, and other health issues. So a change in hazard ratio like this means that for a typical 30-year-old, as little as 15 minutes of exercise a day leads to an increase of 2.5 to 3 years in life expectancy. This study also showed that the health benefits of exercise significantly taper off after anything more than 90 minutes of exercise a day. So, putting this all together, it turns out that to stay healthy, you just need to exercise for as little as 15 minutes a day. To stay fit and lean, you can exercise as little as 30 minutes a day. And you don't get any extra benefit once you exceed 90 minutes a day. And there you have it. I hope that helps, Natasha. And if you have questions about the minimum amount of exercise necessary to stay healthy and you want to join a conversation about this, then head over to facebook.com/getfitguy to find out more. And until next time, this is the Get Fit Guy asking you, what are you waiting for? Go get fit.